forward with our first panel discussion, that is AI is designing hospitals smart and predictive infrastructure. May I request all the esteemed panelists to join us upon the stage. To moderate this session, may I invite Baldev Raj sir, founder and CEO, Prius Healthcare. Give him a big round of applause, everyone. Dr. Shuchin Bajaj, founder director, Ujala Cygnus. AIR Marshal Pawan Kumar, Technical Advisor, Rus Education Vice Chancellor, Lincoln American University. Dr. P.R. Sodani, President IIHMR University Jaipur. Mrinal Sharma, co-founder Flipspaces. Thank you, sir. Now I request Mr. Baldev, sir, to take upon the stage.
Morning, everyone. I think every session has a different kind of setup altogether. That's why this moderation, they have requested me to moderate from here. I believe I will do it or I will come that side so that we can take this session forward. I want to say that all the eminent personalities who's on the dais right now, people are aware there is no requirement of an introduction of Dr. Shuchin, to Mr. Pawan, to the Sodani Saab and to the other gentlemen. We'll straight go to the moderation of this particular activity. Why? Because we feel we are running little late. They have already instructed, but I'll go quickly on this particular side so that we can take it forward. And love to take this moderation to everybody that although the topic is AI is designing hospitals smart and predictive infrastructure actually, but we'll not stick to only technology. That's what I thought about it. Let's not stick to technology only or only take to that matter. We'll take it one by one to how it can make us smarter and how we can do a patient safety or a next level of the exercise and how we can utilize AI better into the coming time. Fine. So looking around this expo, we see absolute cutting edge of the healthcare ecosystem from medtech innovation and leading hospital to advanced infrastructure. We are witnessing a massive shift as how healthcare is built and delivered. Which is exactly why it's immense pleasure for me to moderate this specific session today. Let's dive into our official topic. And I'll go. I think it will be better if I sit here and then do the session. No, exercise is always good. But the point is, if I am discussing something with you and I'm standing there, it is a little difficult for that matter. So I'll straight away come to Dr. Shuchin, to you, although we know everything. But I want to ask you that Cygnus is doing incredible work in Tier 2 and Tier 3 Bharat. A smart infrastructure are historically viewed as a premium, expensive and upgrades. How do you leverage predictive tech to actually lower operational cost while simultaneously elevating your brand as a modern high quality provider in a price sensitive market?
Yes, thank you very much for this question. I think all of us are looking for that magic pill where we can provide very high quality at very low cost, in a trustworthy environment. I think traditionally we've been conditioned to believe that you can choose usually only two out of these three, right? Affordability, trust, high quality. So people usually believe two out of three is possible, all three is very difficult. If you really want very high quality, cost should not be, a factor that you put it into your... But I think AI and machine learning both have the potential to make sure that we leapfrog all those, barriers that the first world and the Caucasian world has shown us that they are like insurmountable. We can actually leapfrog those barriers and achieve all three in an environment that is closer to the community like we try to do. We try and open hospitals in Tier 2, Tier 3 towns like Kaithal, Rewari, Kashipur, Sitarganj, Bahadurgarh. These are the towns we are in, right? And usually people have not had access to high quality services in these towns. They've been forced to travel to Delhi. I remember when I was training after, at KEM Bombay, which was like a very high-end institution at a very high metropolitan city. I came to PGI Rohtak, and at that time to get an MRI done you had to travel to Delhi. Even to get a CT reporting done, I remember one of my very close friends had an accident and they wanted a second opinion of the CT film. So I took the CT films and traveled to Delhi to get it reported by a radiologist physically. I used to come to Nath Brothers, a chemist shop here, to buy medicines for some of my friends or relatives who were admitted in Rohtak because those medicines were not readily available. So those things were, we said that we have to accept them, but now I think with all this technology in place, you can't even think that you would do these things, right? So right now we've reached a stage very clearly where a lot of information is available to us, all scans, all reports, everything is readily available to us. We are very rapidly moving from information to insight, that we have these data analysts, softwares coming that who can actually analyze the information that we have with us very quickly now, give us all these insights that this is how you're using your facility, these are your reports coming out. And I think within the next few months, not years, because speaking of years now seems like we spoke of decades or centuries earlier, the things change so fast. In a few months we'll move from insight to foresight, right? Because we will then know exactly what is going to happen, how much you're going to use your OTs, who's going to use your services, who's more likely to come into the hospital, who's not. So which is the patient in the ICU that is going to crash, which is the patient that will stabilize. So all these foresights I think we will develop very, very quickly now with the software available. Usually when we talk of AI and talk of this technology, we visualize a future like the future, that robots controlling everything, spaceships going in and out, rockets. But I think that's something that's not really something. AI is already inside us, right? Right from when you start searching something on Google, it predicts the next 3 words that you're searching for, right? Predictive text is there. When you go on Netflix, it predicts the movies that you want to see. All this is AI in regular place each and every day, right? So if we are using that in a small town setting, in a hospital, I think it is quite transformational to us, because it democratizes medical knowledge and medical facilities to everyone. Now my resident sitting in my hospital in Moradabad has the same information and knowledge at his fingertips that a Mayo Clinic physician has, right? There's no differentiating both of them. Earlier, that information used to percolate down to us 5 years down the line when they had finished the research, started publishing, it came in books. It took 5 years for us to understand that. Now we are at the same level. My resident can make the same decisions. The clinical decision support systems now are available to him at exactly the same point. So I think it is making the world a lot more flatter. It is helping us a lot in reaching out with services that we could not dream of earlier. And I think in the next few months, medical science will be democratized a lot more than it is now.
Superb. But if I add to that, and I'll go to the next panelist for sure, but I want to ask you, sir, first, that how the tier 2, although you are seeing a lot of things in tier 2 happening and a lot of new diagnostics, new AI things are coming up, do you really see right now that diagnostic and all those things can be done with the AI right now? Or is it taking some time?
No, absolutely. A lot of things are happening. So, see, you have to see how technology scales up very fast, right? I don't know if I've told you this before, but I tell everyone this, that how I was introduced to WhatsApp. So I used to be the clinician and the manager in the first hospital, right? I went straight from college, actually dropped out from gastroenterology to start the first hospital. And I used to be the clinician also, the manager also, the owner also. Like we used to call ourselves P2P, P and 2 promoter, right? Everything I have to do. So ECGs are notoriously difficult to understand, right? They're just squiggly lines and you have to read out a lot of information from a squiggly line. And for residents, it's even tougher, right? I remember when I was doing my MD, I read 4 or 5 books to study ECG. Even now I make some mistakes. But for a resident just fresh pass out, it's much more difficult, right? So I used to get calls from the residents, the patient has come in, something is wrong, patient is not comfortable, not getting relief. ECG is showing something, I'm not very sure. So at 2 a.m. I had to, get out of bed, drive all the way to the hospital to see a normal ECG. And I was very, buzzed that this is not correct. Then next day again, the same thing happened. So we were sitting at an event like this and I met a fellow doctor and said, this is so bad. No, I keep training my residents. They don't get trained. I don't know what to do. They can't read those ECGs. I have to go at 2 a.m. every day to read a normal ECG. And then he told me, haven't you heard of WhatsApp? It was, I think, 2009, maybe 2009, I think. He said, have you heard of a thing called WhatsApp? I said, no, what is it? He said, it's an ECG transmitting software that you can install on your phone. I was like, what? He said, yes, they can take an ECG and then transmit it to you. So this is how I got to know of WhatsApp. And 15 years down the line, if you're saying that somebody did not know about WhatsApp and it is so mainstream for everything, were you stupid? So the technology changes very fast, right? And then you stop remembering that what it was before that. When I was in medical college making a call from Bombay to Delhi, I had to actually jump out of the hospital wall after 11 p.m. because they used to shut our hospitals at 10 because it was too expensive for me to make a call to my house before 10 p.m. because the quarter rates came in at 11 p.m., 1/4 rates. Otherwise, I would spend all my monthly money on just making phone calls. So this is how it has changed. Now, all communication all over the world is free. You don't even think of doing anything, everything is free. So things change very rapidly, and in medical science also, they will change very rapidly before we know it.
Thank you. Thank you. I'll go to Air Marshal sir, Pawan sir, and thank you very much on this panel, sir, because you guided, mentored a lot of people, lot of institution. You were on NEBH and so on. In fact, when I was with the hospital chain, everybody, I look up to you and I think Shuchin sir remember when I was with the RG and the other thing. Now the guiding a lot of. But I'll come to you about your question that your background is armed forces, represent the pinnacle of strict protocols and standardized care. Can AI, predictive infrastructure, finally bring that level of a military-grade precision and a zero-error patient safety to civilization of hospital or hospital networks?
Firstly, I think I must thank MedGate for giving me an opportunity to share my experiences with all of you, and thank you for having me on the panel. Wherever I go in any conference, this question is very common. They have to relate to the armed forces, defense services. Wherever I have gone, this question is there. Defense services, can it be applied to the civil hospitals? Well, let me tell you, defense services is a part of the same environment where the civil hospitals perform. So they are interchangeable. What is different in military? When military adopts and adapts, then it lays down protocols which is easier to implement because of discipline, order, and extensive monitoring, which reduces over a period of time. Perfect. Because systems get set, so monitoring reduces, and those who are responsible for monitoring start looking forward, what else we can do better. Right. And we imbibe everything from a civilian environment. We don't imbibe from military environment. Rather, civilian environment is more innovative and more creative. Right. But we implement faster, and we implement better and monitor better. Now coming to this AI-enabled infrastructure with military precision and zero error incidences of patient safety. Well, zero error is aspirational goal. We can say near zero, but we can aspire to have zero errors. Right. Now you see what we have been doing this earlier also when AI was not there. We continue to do it. What we call simulators here. We have been simulating environments in the military physically, manually. For example, if you are going for an attack, there are various ways of attacking the enemy. We simulate before, what will the enemy feel from where I am going to attack? So all possible permutations and combinations are taken into consideration. We simulate that environment, have a mock exercise. It is not necessary where you are least expected is going to be the surprise. which is the most difficult way to reach, that may be a surprise for them. You know, like in Kargil operations, they never thought that they will not come from a sideways or steep fall and intensive rock climbing. But military did it because they surprised them, because they went to the least, not even least expected, but almost impossible terrain to access to reach there. So what we do, we make smart command centers. You know, now in AI says the same thing. You make smart command centers in your hospitals, which means you've got real-time data pertaining to your availability of beds, availability of resources, and your availability of equipment and everything else. So you know how to reallocate your resources in quick time. So that is what smart command centers, which you can imbibe from the military, put AI and make an infrastructure as per those guidelines, number one. Number two, in hospital administration, we say that hospital planning means form should follow the design. Means whatever the other form should follow function. Whatever the function, the design should be as per that function. With AI-enabled infrastructure, you can put in what are your requirements, so you get proper layouts. What earlier on we called CAD. What was CAD? Computer-aided design was the computer helping to design. Now here you're putting in database as well, and experiences and your requirements, and getting the best outcome. So you can use AI-enabled computer-aided designs to have facilities where there will be no redundancy of spaces, where better space utilization and patient flows will be unidirectional. There will be no crisscrossing of traffic. So you can use this. Third thing is this predictive maintenance, what he was talking about. You know, predictive diagnostics. You have predictive maintenance, and how it will help you, all your HPIE systems, it will, and all your energy-based systems. This predictive maintenance will detect error in advance, what we will call as AI surveillance mechanisms, wherein you can detect fires before the first smoke is sufficient enough to raise the alarm. So you can detect this earlier and prevent a major episode. Again, you can come to almost zero error fire safety. Similarly, you can use predictive medicine, predictive diagnostics, as he brought out, for improving your operations and reducing the errors. I have seen in hospitals in India where they're using robots for entire medication management systems. They're using AI for managing medications in terms of dispensing. But where we lack, now you see, this is where there are certain challenges. Now I saw that robo is going there. How does the robo pick up the medicines? He picks up by the barcode. Now that barcode has to be specific to that robo.
Right.
In the night, I used to see a lot of people sitting there and changing the barcode as per the requirement of that robo. So we have to standardize the right at the point of manufacturing to apply this type of structures. When you put in the otherwise, you're having more staff changing the barcodes rather than dispensing medicines.
Right.
So you have to think in those lines also. Last thing which I would like to say was, see, when you talk about zero error will come if and only if you do not replace cultures, but have a culture which will be supplemented and enabled by AI. And that's why I like your question when you said AI enabled and not AI supplemented.
You're right.
So it's an AI-enabled infrastructure in the armed forces. We do it as per the simulation models which we're doing in the past. Now we're using AI for it because data collection has to be robust. And the last thing I would like to add here, that finally it is how you apply it.
Right.
How you implement it, that will make a difference, and that will actually take out the best of the AI that you are getting today. Thank you.
I'll come to sir. You have been on the board of the NABH and the lot of bodies. Do you think the AI will be taken in those kind of bodies very quickly, and how it can help those bodies also? Because that's another angle to it.
Okay, let me now say this. NABH has to subscribe to international standards.
Right.
Now, NABH is also accredited by International Society of Quality Assurance. The International Society of Quality Assurance, in their assessment of standards and organization, they have a separate chapter on use of AI and digital technology in healthcare, to which each organization has to subscribe to it.
Right.
Now in the revised standard, if you see the 6th edition of standards of NABH, they have put that all organizations will use AI technology and digital technology, even if it is in infancy. They are required to use it and provide evidence of the same. That's how NABH is going to promote use of AI in patient care services, patient care processes, as well as in infrastructure and measuring outcomes and revisiting your data analytics, how far AI was accurate. Because we know that AI is accurate, but is that accuracy good enough and validated to the local circumstances or not? So
Sure.
all these aspects are actually now inbuilt into the standards. NABH itself is developing digital platforms which are going to be AI enabled, because all that huge amount of database that NABH has collected, that can be put to effective use for setting internal and external benchmarkings.
Super. Done.
Thank you.
So this is for Mr. Sodani. Hi, thank you very much for coming here, sir. So my question is for you, as a leader shaping the future of a healthcare management. We hear a lot about AI designing hospital, right? But do we have administrators to run them? What is the biggest gap between the smart infrastructure being built today and the leadership capability of the management taking over?
Very good question. And now, as far as health sector or healthcare is concerned, it's evolving very fast in the technological era. And AI is now taking a lot of space. Either it is a hospital or a clinic or university or whatever it is. So everywhere, like, AI is coming in a big way. Now I see that the biggest gap in the hospital is that the organizational capacity. You know, if we talk about AI as a technological point of view, the technology is there, but the leadership or the administrators, they are still need to be trained to use the AI,
Right.
and also take some decisions based on the AI's solutions.
Right.
So the people have to be ready themselves, and the leadership or the administrators. I see that the hospital administrators, they are traditionally trained without AI environment.
Right.
So that is the biggest gap in the hospital environment, that whenever they have received the training for hospital administration, AI was not there, either in their syllabus or in their training or in-house training. Nowhere it is a part. Now we are asking the administrators or the hospital leadership that you adopt the environment of AI for improving the efficiency of the hospital and all that thing. But I see that most of the administrators nowadays, either it is a public healthcare institutions like medical college or the district hospitals, or even the private hospitals. Most of these need skill-based training to
Right.
better understand the AI, their interpretation, and also how to adopt it timely. Many times the decisions in the hospitals are delayed because the people are not ready to accept the technology.
You're right.
Thank you so much. Yeah.
But so let's say another point to that. So you are already guiding the next generation leaders.
Yes.
In your institute, you are guiding a lot of people into it. Do you have some kind of
Right,
infrastructure
right.
support
Yes,
system?
yes. So, as far as-
and,
yes.
and to the add to that, can you guide current people who
Yes.
are on the administrative level?
Correct,
Are
correct.
you doing something, some skill or a training for them so that they can
Well,
also learn AI?
As far as like in IIHMR University, we are
Yeah.
in Jaipur, and
Yeah.
we are a very premier institution in health management, research and education.
Yeah.
We run the postgraduate programs in hospital management, health management, pharmaceutical management, healthcare analytics, and also the public health. Now, what we have learned that, after the era of AI and technology, we have also had a detailed review of our course curriculum, and we have integrated AI into our course curriculum.
Okay.
Either it is a hospital management program, or it is a health management program, or even it is a pharmaceutical management program. and also the Masters of Public Health. Everywhere now AI is part of their syllabus. So every student who is coming to IHMR to become the future leader in the healthcare industry, they have to have training in AI and related issues.
Absolutely.
Also here I would like to emphasize that in IHMR University in last 3 years, we have also established a dedicated, school of digital health. A separate school of digital health has been established. The faculties are working on, the students are getting training on AI, ML, predictive analysis, big data analytics. So all these things are now part of their usual syllabus. Apart from our students, we also do conduct lot of trainings for the government officials. Now here I would like to emphasize that many of the government, like state governments, they have approached IHMR that can you design a 1 week or 2 week program for our senior officials working at state level or decision makers, so that they can be also tuned towards coming future. The AI is there.
That's what my
and the
actually
digital
question
health
is. How
is
will
there.
you train the new ones?
Right.
Or existing ones actually who's already
No,
not
so the
familiar with
existing ones are also coming to the institute,
Right.
and you must be knowing that Government of India has already taken a big lead by Digital Health Mission, and we at IHMR also, providing our help, support, assistance to all the state governments that how we can support them to train their existing manpower who are basically either the medical officers or they don't have the skill set of the digital health as such. So
Fair
that
enough.
is also one of the contributions from our
Fair enough. Thank you very much.
Thank
you very much. To Mrinal, hi Mrinal. So I want to understand from you that how this AI, whatever these three gentlemen who was, I would say, the core, because one understand the tier 2, tier 3 market. In fact, Shuchin understand tier 1 market also. But the lot of people understand only Shuchin, and they always talk about the tier 2 city, right Shuchin? They most of the time ask tier 2 city, and for the Pawan sir, they most of the time ask the, as he said, the armed forces question. From him, the education. According to you, how do you see all these three elements or vertical will take forward in this AI era?
Okay. So I represent, while we are a fairly new entrant to the healthcare segment, and I taking a leave from Marshal Pawan. So my father is also an ex-army officer, so I kind of resonate with your line of thought there. I represent more from the infrastructure point of view, right? How possibly AI can help in not only designing but also execution, because you understand the whole, eventually it's a financial product. When you're building a hospital, you're expecting a certain IRR, and the biggest element of that expense is the capex part of it, which is the fit out and the construction part of it. The problem is more propounded when you go to tier 2, tier 3 towns, because of the fact that Mr. Shuchin was saying that there are projects that have been done in Aggarwal, in very far off towns, right? Now you'll understand that if that capex increases by 5% for whatever bad decision or maybe lack of foresight or designing, it can lead to a great effect on the IRR cycle or whatever you're estimating from the financial result. Right? I believe in time to come, right, AI will need to be stitched with present assets to create some sustainable solutions. So let me give you an example, right? You are designing a hospital, right? It can range from a 5,000 square feet clinic to let's say a 5 lakh square feet hospital, right? Designing itself takes a significant amount of time. I don't need to explain how many consultants and everybody is involved, and it's a very complicated multi-stakeholder engagement, right? AI can possibly, and we do that, we create digital twins of the entire infrastructure, which actually helps you not only just visualize the facilities, but also, navigate it in real time. So you can actually feel that you are inside the hospital.
Right.
There is a holographic display. You can actually traverse each and every 10 square feet of that 100,000 square feet hospital. You can change the different assets. Let's say if you don't want to, if you see that this layout is not functioning, you don't need to depend on a designer that, somebody will do that change and that change will reflect in a week or so, right? Those kind of decisions can be taken real time. Where I feel the gap is still there and where it needs to be bridged is that when this project goes to fruition and when it goes to the actual construction and build out, right? These models are not stitched to real world available assets. So for example, let me give an example. Let's say your hospital requires, let's say 100,000 square feet of tiling, for example, right? Now, if you're designing the hospital, you're saying that this tile is available, and if that tile is not available, right, eventually you're going to source it from somewhere. How do you know that whether this tile is available or not? How do you know whether you're replacing that asset with some other tile, whether that tile will come in the same cost or not, right? And whether after application, is it going to look aesthetically correct the way you envisage it? Now, these are three things that AI will not be able to currently solve if the ecosystems that are supporting it also are not AI enabled. Right? So the vendors who are providing you, the designer, everybody has to have that know-how, right? Their inventory management systems, everything needs to be stitched. And then this tool or this whatever solution we are planning will be a wholesome solution, right? Before that, it will only be able to solve maybe a part of the problem as such, right? So that's possibly what we are trying to solve. We make these digital twins for any kind of commercial workspace. It can range from a 5,000 square feet space to about 1 million square feet. We just built out a 500,000 square feet space for TCS, right? Wherein 17 to 18 different stakeholders from all across the world are able to actually see what is going on in the 10,000 square feet space which they are going to occupy with their teams, right? But that's only going to solve part of the problem, right? The wholesome solution lies in when each and every stakeholder in the whole value chain adopts to this one common standard in the end.
Perfect. I'll go to a rapid fire and I'll ask one common question to everybody so that we can wrap up this wonderful session so that it is well taken by the audience also. So I'll come to Shuchin sir first. So as AI takes over the physical infrastructure of a hospital, what is the one human element that will remain your ultimate differentiator?
I think very clear to me, empathy and integrity. These are the two human things that are non-negotiable if you are doing healthcare. So if you do not have empathy and integrity, no AI will work well.
Okay, perfect. To the Pawan sir?
Okay, I think he said correctly. Empathy and trust-based clinical connection.
Trust-based?
Clinical connection.
Okay. Clinical.
Because the trusting, when the patient is vulnerable, AI will not help. When you have to deal with contextual factors, all that database is not going to help. Contextual factors means your family, your feelings. Then when dealing with human values and dealing with ethical aspects of care, this is trust-based clinical connection. So until unless your human lens, what you call the human lens, your body language, because those subtle emotional cues, that represent the sufferings, that cannot be captured by AI. So this empathy and trust-based clinical connection is a clear-cut differentiator when it comes to, you can have an AI-enabled infrastructure, but that will not help if you do not have these two. He said empathy, I add trust-based clinical connection.
So I'll come to sir, you and Shuchin sir, because you said trust. Sorry, I'm taking little time. But when you say trust nowadays, people search and so let's say hospital things, people are coming or patients are coming to you directly via something. But I feel, because I'm guiding a lot of hospitals and healthcare infrastructure, I feel that nowadays patient is searching and checking you and your trust well before coming to you, right? In AI world, now people are not searching on Google. They are searching on AI spaces. They are searching on ChatGPT. They are searching on other things. How do you see this shift? Because I am seeing a shift very drastically as in the patient behavior. They are well trained nowadays. When they go to the doctor, they are very familiar with their own thought process working. How do you see this? Because they trust, they see the Google reviews, they see the otherwise also, they see your socials, they see what you have done in past. How do you see this? I want to ask this question to Shuchin and to you, both of it, because you are running hospital and the other is guiding hospital actually.
Yeah, so as I said in my earlier answer also, that the medical healthcare space is being democratized a lot, and this democratization and flattening is not just between doctors, not just between my resident and the Mayo Clinic senior consultant, right? But also between patients and doctors. Earlier, doctors used to sit in their, ivory towers and hold on to their knowledge with their different kind of a Sanskritized language, Latin language that, we will do a lap chole or a cabbage on you and patient doesn't even understand what, we are advising but now they know each and everything. If we give them a prescription, an investigation report, they will put it into an AI agent and then ask the AI agent to simplify it for them and then come back to us that this is something. So I think this democratization is good. It builds trust. It opens up the communication. Now the only thing left is to, the model that we are following is a fee-for-service model mostly in private healthcare in India. Unfortunately, in a fee-for-service model, the incentives of the patient and the doctor are completely misaligned, right? Because as a doctor, my incentive is that you have a heart attack, you come to me, I'll put in a stent, and that is how I earn the money, and the IRR that sir was speaking about for the hospital comes into play. And I tell you, your incentive is that I've saved your life, so you are still alive. That is your incentive as a patient. But as a patient, my true incentive is not to have that heart attack. Right? I should not be having that heart attack. I should live a healthy life. My true incentive is if I don't go to the hospital, that is my true incentive.
Right.
But then who's compensating the doctors to make sure that hospitals do not have any patients? So this fee-for-service model brings in a ultra wire incentive which says that patient has to come to a hospital to make sure this whole thing runs. If we can change this model,
Okay.
and then AI comes into play to make sure that you don't go into hospital. So like we have 100 million diabetics in India, right? We know 1/3 of them will end up into kidney failure. We are amputating 1 foot every 5 minutes due to diabetes. Now, if we can understand early on when we diagnose you as a diabetic, that who are the 1/3 that will end up into kidney failure and why will they do that? And who are the 2/3 who will be saved in spite of not controlling their blood sugars? Because blood sugars nobody controls.
Right.
But 1/3 are the ones at risk. Now we don't know, right now it's like a lottery. But if we can know that, study it retrospectively, that these 1/3 had these factors when they started out, these were the factors that were important, these were not so important, and then we identify the patient at the time of diagnosis that okay, you have these 5 factors, so you will definitely end up into kidney failure. Now we need to work much harder on you.
Right.
And we incentivize that diagnosis and that behavior. That is the ultimate level of trust that you can build with the patient. That you are assuring the patient that we will not let you go into kidney failure because of your diabetes. That is something that if you can build, will be a transformational thing for medical healthcare.
Perfectly fine. Sir, to you, how the trust nowadays on the AI world? Because when they search AI
this
about
is
the
common.
hospital.
This is common. I think all those who are practicing medicine, thank you. They all have gone through this because everybody has gone. Let's say for Dr. Google, it might become Dr. AI tomorrow. Okay, this is the common problem. Now, how do you overcome it? We all say we believe in health education or health literacy. All of us may be doctors, may be health illiterate in our own health. So we also look around here and there because we're not experts in everything. He also right to look around. But does he give the correct prompt? What we call in AI language prompt engineering. Does he give the correct prompt? He doesn't know. He says, I've got these symptoms. Now, please tell me what it could be. He comes prepared. What should be my treatment? He comes prepared. There where the trust element has to be built in. How it is built in? First T of trust stands for transparency. So, allow him to be himself. Tell him what do you know about it. He will tell you. Then be responsive to him. Based upon what he has seen. Once you are transparent, open to listen to him. That is the first thing he gains confidence in you. Okay. Then you respond to him as per the requirement at that particular time. That is the R part of the trust. You should understand what has he come to you for what. If you understand his needs and he understands that you have understood his need, trust develops. S is be specific. Don't beat around the bush.
Right.
Moment you beat around the bush, the patient is lost to you. So be specific. And the end, a patient must have a takeaway.
Sure.
At the end of all that interaction, patient must have a takeaway. Believe it or not, that patient tomorrow will not see Dr. Google, will not see Dr. AI, he will see Dr. Pawan Kapoor only.
Perfectly.
Okay, thank you.
So Sodani sir, one-liner about how AI takes over the physical infrastructure, and what is one human element that will remain your ultimate differentiator?
Right.
One line or one sentence.
Yes.
Sorry, they have taken a lot of time.
No, I have already, taken their words. Like, healthcare should be like AI plus empathy, trust, and I will add one more, like human touch.
Oh,
So without human touch, I think the patient will not be so satisfied unless until some human touch. So, and second thing, what I see that in the healthcare market, the demand is generated by supplier, and therefore we call it supplier-induced demand. Somehow, because of AI, now the supplier means the patient will not totally dependent on supplier-induced demand. Here the supplier are doctors and providers. So before connecting with the doctor, he is generating lot of information from AI. So that is the source of information he have now. Otherwise, without AI, he doesn't have that much information.
sure.
So now I think in the futuristic, coming years, when the patient will meet the doctor, he will meet some information about symptoms, treatment, and everything. So I think the role of doctor is now enhanced at a value addition. What he can put a more value to that
As a
overall
human
thing.
touch.
Yes.
As a human touch.
Thank you.
To Mrinal. Yeah.
I think the other panelists are.
Yeah.
Yeah, I think I'll just take a leaf from the other worthy panelists. I think they are far more informed than me. But if I have to take a layman perspective, it's just, I think it's predictive care. Right? There are a lot of tests that are possible to do today that can predict what will happen to you 10 years ahead. Right? There might be a certain diet that looks fundamentally correct to somebody, but it might not be correct for me. A lot of sportsmen do it, advanced athletes do it, right? So that kind of predictive care is important, and it's important because of the fact that the average age of the patient now is reducing. It's not, I don't think we're treating 70-year-olds as frequently as we were doing two decades back, right? And that comes because of the fact that the dispensable income has increased, and unfortunately it has got with it a lot of habits that people want to dispense of, but they cannot dispense of, right? And these kind of problems, healthcare problems will come. It's about predictive care and telling the person that, this is something that you are at risk at. If you course correct, well and good. If you don't course correct, then we are there. It's as simple as that. So that's something that AI can solve, and then the human element can solve that. Somebody is there to kind of solve the problem for you.
Thank you. Thank you very much, every panelist. Although I have asked for a one line or a one statement, everybody has given. That shows that how much knowledge my panelist has for this domain. Thank you very much for everybody. And thank you, audience. Thank you.
Thank you for the insightful session. May I now request Dr. Upasana ma'am to facilitate our panel. Please join me in welcoming her upon the stage with a big round of applause, everyone. Thank you all the panelists.